Hi, Joy Horner here. Another thoughtful Thursday, and again, not really sure on the topic until I start talking and see what comes out. Yeah, it's whatever pops into my head as I search through my memory banks of all the births I've attended and labours I've attended and families I've cared for over the past 18 years or so. Uh, so yeah, there's something about positioning today, uh, triggered by a couple of things yesterday. So on my Facebook timeline, one of my memories was a beautiful video. I don't know why my nose always itches when I start to do these videos. A beautiful video on YouTube, and I think it's called Undisturbed Birth, and it's set in the 70s. It's got really dreadful music with it, and it's just beautiful. Women just having their babies and then taking a moment and then tentatively reaching down and touching their babies. And then, I don't know if there's any prompting or not because there's this awful music over it, but hopefully it's unprompted. At some point, they pick their babies up and hold their babies. Um, and it's good to see what a long process that is, actually. Nobody's pulling the baby out, nobody's gifting it to the mother as if it were a delivery, a parcel, which it's not. The mother has worked really hard to get this baby out, to get the baby in, and carry the baby for 9 months, and then to push the baby out. She's worked really hard. So why do we rob her of that moment of claiming her reward, claiming her prize? Oh, this wasn't what the talk was going to be about. Anyway, this is how it flows. So yeah, why do we want to rob her of the moment of claiming her baby and picking it up in her own time once she's come back from that labour land that she's been in? Yeah, she needs to claim her baby. Anyway, in this beautiful video, most of the women were squatting. And it was in the 70s in Brazil, I think. And this, I guess, was the way that women wanted to give birth. Perhaps they were used to squatting a lot in that culture at that time. And the whole setup was for squatting. There was a bar that women could hold on to on these beds. They weren't on their back trying to push a baby up against gravity. But yeah, so it's good to watch to see how women can give birth physiologically. And someone commented, what did I think about the squatting position for giving birth? And there was a trial, I think she said the Peaches trial. Haven't read that one. Haven't read a lot of research, to be honest. The research I do is with the women, in my care. I learn from every case and I then read up about what I've seen, and yeah, I do a lot of reading, but only when it's applicable. So I've never really looked into the research behind positioning because, again, my clients adopt whatever position is physiologically best for them at that time with that baby. No way should we be dictating position. Yeah, because we don't know what position the woman needs to be in to give birth, do we? The whole movement of the mother and the baby together during the labour is one of moving the baby through the pelvis. So the mother and the baby are active participants and involved in this intimate dance that they do together, and one steps forward and the other has to step back because they're dancing together. So if we tell a woman to be in a certain position, and let's pick the worst one here, flat on your back in labour, then she can't make the move, and then the baby can't respond to that move. Do you see what I mean? If we think of the pelvis as being a nice bowl shape and the baby's head being it's not exactly a sphere, and the woman's pelvis isn't exactly bowl shaped, it's more of a slightly compressed ellipse, and baby's head is is sort of ovoid too. So yeah, so they only fit together in certain ways, in certain positions, depending how deep the baby is in the pelvis or in the birth canal. So the woman knows how to move that baby through because of the sensations she receives from the baby. If she gets lots of lower back pain, she leans forward. If she's having lots of lower back pain in her labour, perhaps the baby has its back towards her back, the back of its head towards her sacrum, towards her spine, and that's pretty uncomfortable and gives you backache. And really, you just want to lean forward and get that pressure off your back, off your spine. And in leaning forward, this encourages the baby to move away from the spine. It's really not rocket science, is it? If you can imagine being on your hands and knees, and hopefully the baby then will rotate round to the front. It's in a bag of fluid. It should be able to move round to the front. And sometimes women need to move a lot in their labours, in whatever position they're in. Even if they are on all fours or kneeling or squatting, perhaps they need to be lunging or rotating the pelvis or doing a figure of 8. There's a lot of movement that needs to happen to get these babies through. And I think this is where we fall down so terribly when it comes to giving birth in hospital. Because what are we faced with when we go in the hospital room? A flat bed. And yes, these beds do come in various models and types, and you can get them to sit up and look like big thrones that you can sit on, like birthing chairs. But I've never seen anyone actually do that for a woman in labour. Occasionally they'll put the stirrups out so she's got something to rest her feet on, but mostly the only adaptation that's done on that bed is to lift the back up a little bit so she's not totally flat. So there we are, we're faced with a bed when we go into the room. And being good girls that we are and doing as we're told, if there's a bed, surely that means we ought to sit on the bed or lay on the bed. And this is what a lot of women automatically do. They come into the labour room, on labour ward or in the birth centre, they see the bed and they hop on it. And that's without our encouragement. Put that together with hospital guidelines and policies about monitoring babies. If a mum's high risk and she needs a CTG, continual monitoring, perhaps she'll be asked to lay still while they do the monitoring, and that it's difficult to do it in any other position. Yeah, it's difficult, but it's not impossible. So if you need continual monitoring, you don't have to be flat on your back. You can be standing, you can be kneeling, you can be squatting. Someone can hold the monitor where the baby's heart is. If your moving dislodges it, you can hold the monitor where your baby's heart is so they get a good reading. It shouldn't be a reason to lay flat on the bed. The other reason women get stuck on the bed is that they're asked if the midwife can check how labour's going. Sorry, my arm's aching holding the phone, so I've got to switch to the other arm. The midwife asks if they can check how the labour's doing with an internal, and that's a whole different video that we're going to have to do about internals. Because I don't think they're very good at assessing how labour's going at all. That's just my opinion. So the woman is asked to lay down flat on the bed so the midwife can do an internal. So the woman may have been very active and upright, moving around the room in her labour, squatting on mats on the floor. She may have been in a birth pool, and she will be asked to get out and get on the bed so the midwife can do an internal. And this is absolutely preposterous, absolute madness. We can do internals in the pool. We can ask you just to stand up and do an internal. We can do an internal on all fours. It's not rocket science at all. But that's down to the midwives and down to the women to say, actually, I don't need to get on the bed. I'm happy doing what I'm doing, and can you do the internal where I am, or not at all? Because once you're in strong labour and you lay down flat on the bed, not only does it make the contractions appear worse because you can't move and you can't soothe yourself by moving, that it's also a it's a really bad position to be in. Baby can't move itself, you can't move yourself, it's really uncomfortable, and then it's really hard to get back off the bed because you're tired and you need to just lay down. Everyone wants to lay down in their labour, everyone gets tired. If you have to lay down, lay on your left side, do not lay on your back. And if you can turn to your right side occasionally, but mainly lay on your left, and this helps rotate babies if they're in a difficult position. That's it for today, because my dog is telling me the postman's come. Okay, bye.